Okay. Okay. Good morning, everybody. Am I audible? Everyone can hear me? Okay. Okay.
Yes, ma'am.
Yeah. So, divine morning to everyone, and it gives me a great pleasure again to be here on this platform again with with a really enlightened audience of spiritual doctors. It's a great honor, and I thank Dr. Sandeep and Dr. Saurav to again invite me. And I'll be talking on a very, very important topic, very fascinating now on the vagus nerve. And अभी वैसे इसके बारे में तो बहुत सालों से पता था, लेकिन lot of research is now going on also about its function. And so let's start. And so as we all know, the vagus nerve is one of the 12 cranial nerves that arises from the brain. And it has a course which goes right up to the body as compared to the other cranial nerves. And the importance of vagus nerve is that it is the epicenter of the mind-body connection, and it is really related to our well-being, our self-regulation, and homeostasis. So to know, let us, it has a lot of functions in the body, and to make it healthy and for our best well-being, how we can work on it and improve on it is what, and with lifestyle changes is what we will discuss today. So, so as you are all aware of, there are 12 pairs of cranial nerves, and all the cranial nerves, the first two supply the forebrain, and the other cranial nerves, mainly the head and the neck region. But it's only the 10th, means the vagus nerve, which goes all the way down to the lower abdomen. And we will know about that. We will see the entire course. And the vagus name comes from the term vagabond. In Latin, vagus means vagabond or wandering. So because the vagus nerve goes right down and it wanders in the entire body, that's why it is known as the vagus nerve. So just to briefly brush our knowledge of anatomy, there are 12 cranial nerves. The olfactory, optic supplies the eyes, and the other nerves, which are all the auditory, the motor functions of the face, the throat, the brain, and the taste, the tongue. And vagus nerve is the only one that goes all the way down, as you can see here. So it arises from the medulla, just below the midbrain, the pons, and the brain stem, that is, and it then gives rise to some branches, the auricular branch to the ears, also to the eyes, and then it travels down and it supplies, it goes on the side of the throat and in the carotid sheath along with the major artery and the vein in the neck. And then it supplies our vocal cords, our voice box, the thymus, which is related to immunity, and then the lungs, so our the bronchi, and the lungs, so it's important for breathing, and we'll come to the functions, and the heart, so for blood pressure regulation, heart rate, and then traverses through the diaphragm and then into the abdomen. And you can see here that it gives branches to all the major organs in our digestive system in the abdomen. So starting with the liver, the gallbladder, and the pancreas, the spleen, both the kidneys, the small intestine, right, the large intestine as well, up to the transverse colon, and also in the females, the reproductive organs, and the bladder in the males, of course, both. So it has really encompasses the whole system, very important system in our body, the digestive system, and how it affects and it interacts. And it is the major communication from the intestines, right, and to our brain, and how it interacts with the gut microbes, microbiota in the intestines also we'll see. So as you are all aware that we have two systems, nervous system in our body, the autonomic nervous system, which regulates all our vital functions, and which we are not aware of. So that is why the term autonomic. And there are two systems, the sympathetic and the parasympathetic. And sympathetic both are needed for our day-to-day life, and both need to be in balance and homeostasis. So how that happens is what we are going to see in this talk today. So sympathetic nervous system is for our fight and flight response, and freeze also. So whenever there's a threat, or whenever we feel threatened or in fear, that is when the sympathetic nervous system operates, and it increases the heart rate, dilates the bronchi, it stops the digestion. So it is an accelerator. And the parasympathetic nervous system is a deaccelerator, and both need to be in balance. So whenever there's a danger, we either run or we freeze. So that response, and the hormones that are produced in this are the cortisol and the adrenaline hormones. And in the parasympathetic nervous system, the vagus nerve is the most important nerve. And this is for rest, digest, and relax. And this is also equally important. Both are important. So here it helps in the digestion, in lowering the heart rate and blood pressure, and bringing a very calm state. So this balance we will see in detail, and how to achieve that. और दूसरा है the gut brain connection, or the enteric nervous system is now a third nervous system, which is also very important. And there are so many nerves and nerve endings in our solar plexus, and this will really resembles the brain nervous system a lot.
Ma'am, sorry to disturb you.
Yes.
Kindly do the presentation mode, ma'am. Kindly do the presentation mode.
Yeah. Now, can you? Okay.
No. Yes.
Okay. So the third nervous system is the enteric nervous system, and made up of trillions and billions of nerve cells, also in the enteric nervous system. And that's why, as I said, it's called the second brain. And the solar plexus and also the vagus nerve connections with the solar plexus comes about. So the sympathetic nervous system comes from the spine, and then it supplies to the solar plexus, whereas the parasympathetic nervous system comes from the brain. So there is a real communication between the sympathetic, parasympathetic, and a lot of interaction via your hormones, neuroendocrines, neuropeptides, and most important via the vagus nerve. So let us see that. So the gut-brain connection, it has an effect on the gut microbiome metabolites. So there are so many genes of the microbes, more than almost 23 million genomes, and the human genome is about 20,000. So there are more genomes and genetic material of the microbiota which are in our gut. And this interaction has far-reaching implications, not only to our health, but also our emotional health. So it influences the motility, secretion, nutrient delivery, the microbial balance, and neurotransmitters, but also the stress and anxiety levels, our mood, and our behavior also. So the gut microbiota are the potential key modulators in the immune system and the nervous system. And so targeting the gut microbiota will really improve our emotional symptoms and also our health. And it has a lot of effect on depression and anxiety. So there is growing evidence that nutritional components such as probiotics, prebiotics, gluten, some medicines, some drugs, some antioxidative agents, and antibiotics, they have a great effect on the vagus nerve, and its activity and its interaction with the various germs and the fungi and the yeast, and great population, very diverse in our gut, in our intestinal system. So there are now in humans, there are now some medicines available as psychobiotics, which are a class of probiotics. So probiotics are, again, they are colonies of certain helpful bacteria which can be introduced in our system that have an anti-inflammatory effect, and it might be also useful in patients with certain psychiatric disorders and depression. And because these have antidepressive and anxiolytic effects, so there is a lot of research going on in this, and we'll see this also. So a lot of research, as I said, is happened in rats so far up till now. So these the microorganisms that we have, they start from the birth, and then they can vary, and they are stable mainly in our adult life. And then they can, of course, change with our environment, our food, our nutrition, and our lifestyle changes. So they have used germ-free mouse for these experiments. And these microbiota can be affected by a lot of these conditions here, like diet, environment, whether how much pollution we are exposed to, certain antibiotics. Some of the antibiotics can destroy the very beneficial bacteria in our system, aging, then probiotics, exercise, and the mode of delivery, vaginal delivery. There are better microbiota which the baby ingests, and of course stress. And they did a lot of research on germ-free mice, and where they injected these microbiota from patients who were suffering from Parkinsonism, depression, Alzheimer's, and they found that these mice started suffering from those conditions. And when these mice, there was vagotomy done, when the vagus nerve was not present, then these symptoms did not happen. Same way when very beneficial bacteria like the lactobacillus bacteria was introduced in these rats. And so that helped in depression. But when the vagus nerve was cut, then the same effects were not there. That means that the vagus nerve is so important in communicating with these microbiota and with the communication with the brain. So, and it communicates via, there are so many folds in our intestine in the mucosal levels. And the vagus nerve has both sensory function as well as the motor function. So sensory function is through the nerve endings that are there in the mucosal lining, in the villi, and the motor function is when the nerves are in the muscle layer of the intestine. So this is a very fascinating topic, and exactly how these changes happen is still they're working on, but they're very exciting research going on right now. And so these are far-reaching implications, especially in treating those patients with depression and psychiatric conditions, where instead of giving them very high toxic medicines, which are so difficult to go through the blood-brain barrier, whereas if we can work on the second brain, and then a lot of benefits can be there, and improving our health and stimulating our vagus nerve. So as I said, the primary function is the parasympathetic, how it is responsible for the operation of our digestive tract, heart rate, our respiration, and the sensory, even our taste from behind the back of the tongue. Also, all the specific mechanisms of the abdomen, heart, lung, throat, and motor. So our enabling speech, swallowing, our gag reflex. So it is supposed to suppress inflammation via the cholinergic and anti-inflammatory pathway, the vagus nerve. It decreases the heart rate and decreases the vascular tone, so improves the relaxation. It increases the gastric juices, gut motility, and the acid that is produced in the stomach. So it aids in digestion. It regulates the insulin secretion and glucose homeostasis in the liver, so it helps in detox. And in the mouth, the taste information is sent via 3 cranial nerves, but vagus nerve is one of them, and is needed for the gag reflex. If there is, the vomiting and swallowing and the coughing. So that is where the vagus nerve is useful. And it decreases the vascular tone. It lowers the blood pressure. And in the brain, it helps by keeping anxiety and depression at bay. And it opposes the sympathetic response to stress. So ये अभी हमारी जिंदगी ऐसी हो गई है कि बहुत ज्यादा स्ट्रेस हम ले रहे हैं, हम क्रॉनिक स्ट्रेस में जी रहे हैं। तो कुछ भी जो भी हम कॉन्स्टेंटली एंजाइटी और फियर में रहते हैं, ट्रैफिक से या छोटी छोटी बातों से, या चिल्ड्रन एजुकेशन, कुछ भी आप ले लीजिए, तो ये हमारे normally sympathetic system is on the overdrive, and we tend to forget to use this parasympathetic system and the vagus nerve to bring this imbalance, and that is what we will discuss now. So when the vagus nerve is not functioning optimally, so these are the long list of diseases. The lambi list hai ye ke this almost 80% to 90% of the people, actually even I see in my practice, they all suffer from some condition like this. It's so let's go through this list, and you must be knowing at least somebody in your family or in your friends who is suffering from all this. They are so common, and they can all be tackled by lifestyle changes. So diabetes, heart conditions, thyroid problems, stomach and digestive problems. Almost everybody has acidity, complaints of acidity, gas, bloating, then epilepsy, fainting attacks, the vasovagal, the syncope, as we say, that is also by the vagus nerve, nervous system disorders, anxiety, multiple sclerosis, degenerative disorders like Parkinson's, anxiety, stress, food allergies, sensitivities, autoimmune disorders, mental clarity, memory loss, brain fog, and going on to the emotional and psychiatric disorders like depression, antisocial behavior, immune disorders, blood sugar problems, ringing in the ears, tinnitus, kidney issues, where there's impaired electrolyte and metabolism, water imbalance, gallbladder problems, stones in the gallbladder, ear or tongue, fertility, infertility issues, especially in females, cancer, and autism. So this is a very long list of problems when the vagus nerve is impaired. And this is now an epidemic that we now are constantly, or most of us are on the phone like this, where there's stress on our neck and our cervical vertebrae, and that because the vagus nerve is traveling along in the neck, so it produces a great strain on the vagus nerve, and this also creates tension and impaired function of the vagus nerve. So what are the major causes of poor vagal tone, or where the function is not proper? Chronic stress and poor sleep. Most of us, because now of our addiction to the social media and the mobiles and other electronic devices, there's poor sleep, early childhood traumatic experiences, post-traumatic stress disorders, head injuries, poor breathing mechanics, and say if there's asthma or because of pollution, chronic infections, blood sugar imbalances, and high toxic load. So all this causes a poor vagal tone. So what is a healthy vagus nerve, and what is vagal tone? So when your mind is calm and peaceful, you are in a positive mood, where there's digestion, good digestion, what you eat is digested properly, you have good regular bowel movements, there's no constipation, there's healthy pulse rate, and your blood pressure is in the normal range, your blood sugar levels are normal, your body weight is in the normal range, your speech is normal, your swallowing ability is normal. So all this means if you are, then you are in good health. So that is a healthy vagus nerve. So how do you test the vagus nerve and whether it's functioning optimally? So there are various tests. So एक तो pupillary constriction test है, when a light is shined into the eyes, the pupil should constrict for at least 10 seconds and then it dilates. So if it constricts and dilates in less than 10 seconds, or it does not constrict at all, then that is a sign of a poor vagal tone. And when you compare the heart rate and the breath rate, so normal heart rate is 60 to 100 beats per minute, and the normal breath rate is 12 to 20. So this is roughly a 5:1 ratio. So if this ratio is more, that means that means you have a poor vagal tone. And another test is heart rate variability. Means when you breathe in, there is acceleration of the heart rate, and then when you breathe out, there is deceleration. And more the gap between this means a healthier vagal tone, means it's flexible. And how soon you recover from exercise, how soon your heart rate comes back to normal after exercise, means also you have a healthy vagal tone. The earlier you recover from exercise, your heart rate comes to normal, higher is your vagal tone, or healthier is your vagus tone. Another is blood pressure. A normal blood pressure, which is between the systolic between 100 to 140, less than 140, and the diastolic, which is 70 to 90, which is either not very low and not very high. So that means also that you have a good vagal tone. And orthostatic hypotension means if you normally when you get up from a sitting to a standing position, the blood pressure correspondingly rises. So if it fails to rise very rapidly, and if you get dizziness and poor balance, you lose your balance, that means your vagal tone is poor. So these are the ways in which you can test whether you have a healthy vagal tone or not. So how do we, what do we do to bring our vagus nerve, make it healthy, and to improve our vagal tone? So there are fortunately lots of things which you can do, like so working on the throat, the singing and chanting and humming is very important. So even if you feel you are not a good singer, but please go ahead and sing even in the bathroom. This really stimulates the vagus nerve. It brings your mood up and increases your heart rate variability, and it's supposed to reduce morbidity and mortality. Also, you feel very, very good. There's a well-being and a very improved quality of life. So go ahead and sing and don't bother about whether you sing off key or not. Exercise, of course, and is very good for your brain. For your cognitive faculties, mental health, gut flow, and things, because it stimulates the vagus nerve. So you can exercise either in the gym or outdoors is more beneficial, in nature and exposing yourself to sunlight. And the vagus nerve is also supposed to produce the hormones of well-being, feeling good, and like oxytocin, serotonin, dopamine, opiates. And even exercise is supposed to release these hormones. So both in combination, exercise is the key. And exposure to cold. So even if you are having a shower, in between आप temperature को low करके आप थोड़े seconds के लिए cold shower लीजिए. That also stimulates your vagus nerve. Splashing cold water on your face is also supposed to increase your vagal tone. Yoga is extremely beneficial, and pranayam and breathing, which we'll talk about. Laughter, social interaction, and all group together singing is a great immunity boost, and it increases your heart rate variability, and the entire group will benefit. So all this should be done in a group as a group activity. So having great social circle and laughing, maybe joining a laughter club is extremely important. So deep breathing, breathing slowly and deeply, that activates your vagus nerve. The key, breathing and exercise with breathing. So motility and breathing is the key to improve your vagal tone. And I cannot stress enough on yoga and pranayam to bring your parasympathetic nervous system in balance. And because हमारी अभी society इस तरह से है कि we are under constant stress, so this becomes absolutely mandatory to follow this to bring both sympathetic and parasympathetic as well as our enteric nervous system in balance. Gargling morning में आप whenever you brush your teeth, gargling is supposed to be also very important and improve the vagal tone. It stimulates the muscles of the palate, the soft palate, where vagus nerve, it supplies that, and it improves also the working and memory performance. And mindful meditation, thoughtful meditation, you can improve your mood by simply silently repeating positive phrases, affirmations, and with your friends and family. So all these are the tools that we have, which we can really work on, not difficult. Also include diet, omega-3 rich diet, includes lots of grains and nuts, and because they have those who are vegetarians and those who are non-vegetarians can eat fish, oily fish, sea cod, probiotics and probiotic rich diet, and what is now also known as prebiotic. Prebiotic rich diet means those food that they're supposed to give energy to the bacteria that are there in our gut, and probiotic rich diet. So what are the probiotic rich diet? And we have in our Indian food array of probiotic rich diet, yogurt, idli, dosa, all the food that are fermented. And I think recently I attended a talk again with Dr. Khadir Wali. He spoke so much about millets and the fermented millets, which are so rich in probiotics, and they have such great effect on your mood, and also have on the anxiety, and so many depression, which are drug resistant, can this can work with that just by changing your diet. And there are lots of now food, kaffir, lime leaves are there, kombucha, some of the food that is prebiotic, like oats, barley, apples, some fruits, berries, they give energy to these microbiomes that are there in our system. The curd rice that the South Indians have every day, that is supposed to be very rich in probiotics. So these changes you can easily do in your diet and lifestyle. You just add fermented foods in your diet, and of course probiotics. But the synthetic probiotics that are available in the market, they they can skew the ratio imbalance in the gut microbiomes. So going by the natural way is definitely better. And social, again, hugging, going for massages, and intermittent fasting also is supposed to stimulate the vagus nerve. So we have lots of options, and I'm sure very easy to follow these to bring about a change. And I'm not a yoga teacher, but I practice yoga regularly, and so there's so many asanas that you can do and that stimulate the vagus. Almost all the asanas, like the very important is the cat cow, they say, pose is very important to stimulate the vagus nerve. The Surya Namaskars also, of course, and lots of the Trikonasana and Paschimottanasana, the Veerasan, Veerbhadrasana are some of them, and some of them are right here on the Konasana, Parvatasana. So yoga is extremely beneficial, and it's important to just take out maybe 15-20 minutes in a day to do some of the asanas, and that will really bring about great changes in your blood pressure, heart rate, and stimulate the vagus nerve. Pranayam and the longer the exhalation, easier it is to improve your vagal tone. So they say the easy way to hack your vagus nerve is by breathing and pranayam and a longer exhalation. So you can practice either you breathe in 5 counts, whatever is your capacity, you breathe out to 7, or you can even do 1:2 if you can. If you breathe 5, you breathe out 10, and that is really supposed to kickstart your vagus nerve and stimulate it. Acupuncture, acupressure, working on your reflex zones, reflexology, hand reflexology, foot reflexology, and acupuncture, especially around the ear, there are points and meridians for anxiety and insomnia is very beneficial. And they found that those depression cases with depression which are not responding to any drugs, they can be helped. Those type of patients can be helped by putting a vagus nerve stimulator. It's like a pacemaker, which is placed in the left side in the thoracic cavity, just under the skin, and that can electrically stimulate the vagus nerve. And when they mainly use this for epilepsy, drug-resistant epilepsy, and Alzheimer's, Parkinson's, but they found this was helping with depression also. So of course, organically, and when you can do the other exercise and yoga, pranayama, if you can practice that and improve your vagal tone, is definitely much better for. But for those people who cannot do that, then there is an option of vagus nerve stimulation as well. And important, we talked about acupuncture, acupressure. What else can stimulate the vagus nerve? And that is sound healing. So as we saw that the vagus nerve arises from the medulla brainstem, and then it is so close to our eardrum, the tympanic membrane, and then it supplies your soft palate. So whatever vibrations, and your hearing is mainly to the vibrations of your tympanic membrane. So that that stimulates the auditory nerve, the olfactory nerve, and then you hear. But the vagus nerve also has an auditory branch. And so when you place the singing, or like either the singing bowls, the tuning forks, or the gongs, that has an effect, and your tympanic membrane vibrates, and that stimulates the vagus nerve. And it can be instantly calming, and it brings you from your activity brain wave. So they have actually done studies with EEG, and they've tracked your brain wave, which when you're active, it is beta wave, and then it goes down to alpha when you're relaxed, and then delta, theta. So that is when you're in that state, the healing it takes place, and which is opposite to the fight, flight, and the freeze response. So sound healing also can be used, and I practice sound healing, and with Tibetan singing bowls and gongs, and that is hugely beneficial, and to bring you in a very deeply calm and relaxed state, and which is very conducive to healing, and it helps in a lot of conditions and diseases. So to summarize, with a healthy vagus nerve, we feel relaxed, calm, centered. We are able to navigate life. There's a sense of trust. There's a feeling of empowerment, being in charge, not overwhelmed. So we cannot change our circumstances and whatever life throws at us. But definitely we have control over how we react and how we respond. And we do not react, but we respond to whatever situation and what life throws at us. So with a disengaged or inactive or impaired vagus nerve, one tends to be anxious, self-conscious. We experience a variety of lot of psychosomatic conditions, stomach disorders, your heart rate. Heart rate is either very fast, anxiety, thyroid disorders, various other nerve disorders. So, but the good news is that it is under our control, and it helps us to deal with stress and stressful situations, because there is no control what life throws at you, but absolute control with how you react and respond. And so I thank in deep gratitude to with all my teachers, my mentors, and of course, life and life situations is also a great teacher. So if you take everything as a learning, I'm sure you can stimulate your vagus nerve and make it more flexible and resilient. So it's very important. जो भी situation life में आए, you face it. You are resilient. And during Corona times, I cannot overemphasize how much important it was to bring our immune system and our resilience back, and so that we could bounce back and we experience perfect health. So vagus nerve is very, very important, and we must focus, and we know now the tools how to balance the parasympathetic nervous system, and we must utilize it and to bring it to its optimum capability, so we are the best version of ourselves and we function to the best of our ability and use all the potential that we have. So thank you very much, and I'd be happy to answer questions.
Thank you, Dr. Geeta. If someone has some questions, because few questions are already answered, because from where we can get the what is the option for the vegetarian and the person who are vegan. So if you have any other question, you can type in the chat box. So Dr. Geeta can answer that. Amazing session, Dr. Geeta. It was really, really amazing session.
Thank you. Thank you.
Can you tell us about the asanas?
Sorry?
Can you tell us about some asanas? They're just asking some asanas are good for the, I think already all the asanas has been shown in the that PPT also. So you can.
Yes, yes. We can just.
Yes.
I think it was covered.
Covered, yes.
Yes.
It is already covered. You can watch this video on the YouTube. We will upload this video by Wednesday. So Dr. Geeta, आपने बात किया है sound healing का.
Yeah.
और someone is asking that I am an immovable person. How can I activate the vagus nerve?
Breathing, pranayam can be. Gargling, singing.
Lot of things are there.
Lot of things can be done. Laughing.
Yes.
Laughing.
And watching the sessions on spiritual doctors.
Comedy channels.
Yes. Humming also. There are so many ways.
And mantra chanting. So you can do your favorite, and of course with Sanskrit, if you know your favorite shlokas, singing, humming, chanting, your kirtan, and in a group session. So satsangs, all that can be very beneficial. And
so friends,
asanas also, if you can do, if you are immobile, I don't know if are you bedridden or.
So combination breathing, cold showers, diet,
cold showers,
singing, all things are.
Gargling, if you can, and thoughtful, mindful meditations.
Yes. So Dr. Geeta, I just want to confess that this is one of the most extensive session on the vagus nerve I have ever heard. So thanks for enlightening us. जो हमारे दर्शक हैं हमारे साथ जुड़े हुए हैं वो भी इस बात को मानेंगे. This was really, really, really amazing.
Yeah,
session.
Lot of us don't know. Yes, lot of us don't know about the importance of this, and that is
so क्वेश्चंस तो बहुत सारे हैं डॉक्टर गीता, लेकिन हम उसको प्रैक्टिकल एक्सपीरियंस करना चाहते हैं. जैसे आपने बताया, मैं डॉक्टर गीता दोनों क्लासमेट्स हैं इन द साउंड हीलिंग, लर्निंग साउंड हीलिंग. यस. सो डॉक्टर गीता से हम अगर साउंड हीलिंग का एक एक्सपीरियंस करें और खुद वेगस नर्व को एक्टिवेट होते देखें.
I have learned so much from Dr. Sandeep. I've attended his online courses and on nutrition, on mind-based cognitive therapy, and so I have gained so much from both of them, Dr. Vaishali and Dr. Sandeep. So some of it is what I've borrowed from them, especially about nutrition, and it's extensively covered by your topic with Dr. Khader Wali, of course.
Yes,
and, veganism, there's a lot of interest in veganism, and I'm sure a lot of you follow. You also follow Dr. Sandeep.
Yes.
So veganism is supposed to be very beneficial for the gut bacteria, and but there is also a lot of emphasis on ghee, clarified butter. So
Yes.
especially in an Ayurvedic system. So uh, you have any experience on that, because you are so much into nutrition, because in our ye jo abhi, because we are learning all this because of all these research that is going on in the West, जो रैट्स के ऊपर इतना काम कर रहे हैं, एंड गट फ्री बैक्टीरिया करके उनके बैक्टीरिया निकाल के बाकी डिजीज वाले पेशेंट्स के बैक्टीरिया उनको उन्होंने इसमें डाल रहे हैं उनको, और किस तरह का रिस्पॉन्स हो रहा है. बट ये हमारी सिविलाइजेशन में, कल्चर में तो थाउजेंड्स ऑफ इयर्स से ये सब फॉलो होता है. फर्मेंटेड फूड डाइट, उनको ये सब पता था. ऑफ कोर्स योगा प्राणायाम भी कितने सेंचुरीज से हमारी सिविलाइजेशन में है. तो और लॉट ऑफ एम्फेसिस, आयुर्वेद इज थाउजेंड्स ऑफ इयर्स ओल्ड, और ये एलोपैथी और बाकी सब मेडिकल सिस्टम्स तो बहुत रिसेंटली आए हैं.
Yes.
इसमें घी इज आल्सो सपोज्ड टू बी एक्सट्रीमली बेनिफिशियल. तो उसके बारे में आप
देसी घी. Yes.
Desi ghee, yes. So with A2 cow. So vegans, some of them do, I think, follow a mix where they introduce clarified butter, organic ghee also with A2 cow.
Dr. Geeta, आप screen sharing stop कर सकते हैं, so that right now we don't want the screen. Yes.
Okay.
Perfect. डॉक्टर गीता, तो हम लोग अभी मेडिटेशन में जाते हैं विद द साउंड हीलिंग. डॉक्टर गीता से बेटर हमें साउंड हीलिंग कौन करवा सकता है विद द सिंगिंग बॉल्स. ओवर टू डॉक्टर गीता. इसके बाद हमारा सेशन, आफ्टर द मेडिटेशन सेशन विल बी ओवर.
Okay, I will just let me know if you can hear. I will just put the mic on for the bowls. So you check the sound quality first.
Please.
You can hear?
No, the sound is not that good.
Okay.
It's coming. Yes, perfect.
Okay. So I will increase the volume a bit. Can you hear now? Well?
Yes, we can hear you, but not the sound of the singing bowls. Can you play it again? No, Dr. Geeta, you have to keep close to your laptop.
Okay.
Hold in the hand so that we can.
Yes, I'll do that.
Can you play it again?
Yeah.
No, Dr. Geeta. No, Dr. Geeta. आपने अब हाथ में पकड़ के उसके क्लोज में किया तब it's perfect.
This is better. Okay. And you can hear me also, right?
Yes.
Okay. So we'll do that. So up. So I will.
Geeta, before we go into the meditation, there are so many requests that if you can share your email or your how they can contact your office number or your email ID, so that if you person want to contact with you, please in the chat box. Yes.
Small g, sorry, by mistake. It is small g, not capital G.
Right.
Yeah, I think I.
Geeta@prcbombay.net.
.net, yes.
Yes, thank you, Dr. Geeta.
Yeah, you can contact me by WhatsApp also.
Thank you, Dr. Geeta. We can
Oh.
go into meditation.
So I will, somebody said to show the singing bowls. So they're here. Can you see? These
are handmade,
handmade
15 single bowls.
Okay. So I will have everybody to settle down wherever you're sitting. If you want to lie down, you can do that also. We will do some breathing. And then we'll go on to the sound healing. Sit comfortably, at ease, and your spine erect, but not stiff. And just relax. You can scan your body from head to toe and see if there are any areas of tension, pain, rigidity. Just try and ease those parts and relax. Also bring your awareness to your thoughts. What are you thinking about? What is there at the back of your mind? Is there any worry, anxiety, any worrying thoughts? Or things to do? Just relax, just take a break from them and bring your awareness back to your body. And now you're breathing. Be an observer. Observe your thoughts. Just observe your breath. How is it going in through your nose, through your trachea, into your lungs, and then back through your nostrils, and the warm breath out. Just take some time in just observing your breath, not controlling it. Just observe how shallow, how deep. Just take a few days, just observe for a few breaths. Now bring your awareness in your nostril region. Feel the cool breath traveling through your nose into your lungs, and warm breath coming out. Observe these vibrations. Just hear them. Feel them. Through your ear, in your auditory canal, through your eardrums, relaxing your brain. You can also check with your fingertips close to your nostrils to see which side of your nostril is more active. The right or the left? If it is the right, means your left brain, more sympathetic. And left, right brain, it's more parasympathetic. You will find during the day, your activity will change and alter right to left, left to right. More creativity with right brain. Both are needed to be functional in this world. Take a few long, deep breaths, going right into your lungs, and breathe out. Take a few long, deep breaths in and breathe out. Deep breath in and deep breath out. We'll now prolong the expiration. So first, to the count of 5, breathe in, 2, 3, 4, 5, and count of 10, breathe out, slowly, steadily, continuous, जैसे पानी की धार, not with jerks. Deep breath in and breathe out. Double the count. Deep breath in and breathe out. You feel already relaxed, at ease. And the vibrations are helping. To be in a completely relaxed state. Feel the vibrations traveling through your entire body, like how a pebble, when thrown into the pond, creates a ripple. When every cell, every water molecule starts vibrating and dancing. In the same way, your body is composed of more than 70% of water, and reacts in the same way, bringing into motion all the cells, all the tissues, in your body, vibrating to its optimum frequency. If thoughts come, let them pass like clouds in the sky. Do not identify with them. You are the sky, not the clouds, not your thoughts. Just let them pass. Now create an intention of perfect health and well-being. As we journey along with the vagus nerve, through your body, creating perfect balance and homeostasis, self-regulating all the functions, consciously regulating it, helping it, optimum function of your throat region, your vocal cords, your larynx, the tongue, the thyroid, and its metabolism, tone our immune system through the thymus, the airway system, the trachea, the bronchi, the lungs, the air sacs, where all the oxygenation takes place. Reducing your respiratory rate from 14 to 7. Improving the gas exchange in your alveoli. Focus on your heart, which works non-stop, to make it more efficient with exercise. Improve its tone. And relaxed. Travel through your diaphragm. Let all the pranayam, all the different types of pranayam, the diaphragmatic breathing, which helps, which the babies do normally. Breathe through your diaphragm. All the organs of your abdomen, the liver, so vital for detoxification, pancreas for glucose metabolism, the spleen, blood purification, kidneys for electrolyte balance, maintaining your blood pressure, heart rate, and now your digestive system. Deep gratitude to all these organs and all the gut microbiota which are there in your mucosa of your intestines. Just bring your awareness there. Say thank you to all of them. These millions of workers were there to work for you, for your health and benefit. It's amazing system that Mother Nature has devised. Deep, deep gratitude, which no science, no medicines, nothing can replace. A gift to mankind. So it is our duty to do what we can to maintain this system and not abuse it with our addictions, wrong choices, giving in to our wrong thoughts. And do what we can to improve our mental health consciously with awareness. So I'll end with the affirmation. Mentally say it with me. My body cells obey my will. They dance with divine vitality. I am well. I am strong. I am a flowing river of boundless power and energy. My body cells obey my will. They dance with divine vitality. I am well. I am strong. I am a flowing river of boundless power and energy. And so it is, and so it is, and so it is. You can gently rub your palms, cover your eyes, open them and give this energy to your entire body. And end with chanting of Om 3 times with me. Om, Om, Om. Thank you very much. Deep gratitude to all of you for giving me this opportunity to share this with you. Thank you.